immediately. So when they come, they can join us.
Oh, is it starting?
Yeah, because a lot of people are now ready.
Oh. Alrighty. So what are we doing today?
We are the line as you. Anything you want us to do.
Since there's only a few of us, I'm going to do strictly hands-on today.
We might not need it though, but we might not need it.
I didn't see you.
Speaking of from there too. This one is already picking up.
Oh, okay.
This one's off.
Yeah.
So it's picking up from here also. That's why it's coming.
It was because I unmuted that thing. It was because I unmuted that thing.
You want us to be close to? Yes, please. When we're ready. I don't remember seeing some of you here last time. Okay. Got it. Alright, so I know we did the gloves and
So she's standing there, they're standing there. Or how many
any of
people
you
we're gonna
comfortable with
take?
it?
Or you want to move the camera?
Let me see.
Yeah, that.
Can we not block the camera?
Oh, no.
Yeah, just rest it.
So, do you want to try it or you're okay with that?
Yeah, I want to try it.
Oh, I didn't bring forward.
Oh.
So glove, you want to try gloves?
Yes.
Okay. I'll work with you after those two times. Since she, anybody else? It's just her, right?
Can you hear that?
Okay. So, first we're going to talk about this, which is the ostomy and urostomy. If you're looking at it, you can't tell the difference. They look similar. So if they tell you grab one, you might grab A, and not, by not knowing what it is, you grab it. Reading the name is very important. Looking at what you're grabbing is very important when you're grabbing it. I need you guys to come closer. I only have one of this. So this is the ostomy. Okay. When do you need an ostomy?
When you want to change the colostomy.
Okay. When you have a colostomy or ostomy on, is it called colostomy or ostomy? And what does what does empties into this? Correct. And what empties into the urostomy?
A urine?
Urine. Exactly what it sounds like, urostomy. Okay? So, I'm going to open this up. So, when you get it, this is exactly what it looks like. Okay? This part is clean. Not usually sterile, but it's clean. This is the bag that goes on it. When you get this and you open it, this is exactly what it comes like. If you notice how small this hole is, the ostomy is usually never this small. If you turn at the back of it, it tells you that how to cut it to the size of the ostomy.
Okay.
So you take a scissors and you cut it. When you're cutting it, you have to be very careful to make it smooth, because if it does have edges, the chances of hurting the patient is high. I'm gonna pass this around. Just feel it. When you get it, the ostomy, after cutting it, you peel it off and you place it on the patient. Personally, when I do that, I love applying this first before placing that on the patient. Most times when you get the set, this comes separate from that. So when you grab this, you have to make it the exact same size as that.
Let me ask a question.
Yes.
Do we have to go, we have to count again? Do we have to go according to the whole size of the body?
Correct. That's why there's a direction there to help you with it. So personally, before I put this on the patient, after cutting this, I love to smash it together first.
Okay.
Before I peel this off and put it on the patient. Because if you don't slam, if I don't lock it first, and you try to put it on the patient without locking it, sometimes it feels like you're pressing on the patient. I'm going to pass this around, try to feel putting it together. And when you snap it together, you have to hear it snaps. So I like, when you put it on, before putting it on the patient is always very ideal. Don't forget, when you put it on the patient, you want the area to be a little bit dry when you do that. Any questions about that?
No. I don't know if I've seen it and I've tried it.
Oh, you,
cut it first, right?
yes,
The
correct.
size of the.
To the size of the ostomy, yeah.
The hole.
So you're cutting the barrier first to the size of it. You notice when you're snapping it, it takes a little bit of pressure to do that, to make sure it snaps well. Always remember that as well when you're putting it on the patient. If, once I take this off and I put it on the patient, I'm not done. Because once poop comes out, guess what's going to happen? It's going to come right back out. It's still open. So every bag is different. So before you take, if this set comes separately, before you take it in a patient's room, you want to make sure you're aware of how you secure this part. Some of it is, there's a clip that comes on there, and you just clip it up. So you're familiar with that one. You just clip it up. This one, on the other hand, it's something you have to fold in.
Then you stick. Oh, okay. So you don't have to clip.
You don't have to clip this because this is not secure. Always remember when you put ostomy on the patient, you want this secure. The very first time I did this, I didn't secure this part. You know what happened, right?
That's gonna be best.
You have to start cleaning.
Luckily, I wasn't the one that cleaned it, but it wasn't fun.
Because the smell is different.
Exactly. So you always want to keep that at the back of your mind when you're doing it. You can try to see if you want to lock it. It's up to you. We're going to move on to this one.
So can patients have both at the same time?
Yes.
Yes.
Exact same concept as this, but this one drains the urine out. It's exact same concept, but the bag is different. Always remember to secure it first before or after placing it on the patient. If not, that's a different situation. All right, so we're gonna draw up medication. Who here knows how to draw medication?
I have the theoretical knowledge.
Okay, that's good enough. That's what you need to get started. If you pick this, you think you need to use alcohol swab to wipe this first?
Yes, we need to open it.
If I need to draw medication out of this bottle, and the bottle is handed to me like this, once I pop this open, do I need to wipe it with alcohol before I draw it out?
Yes.
Yes.
Why?
Because there might be some particles.
This is still closed. This is technically still stuck.
It's closed? Oh, because it's closed.
The cap is still off.
Oh, so when
What am I wiping off after this? When it's open,
Oh, okay.
after you've probably took some, let's say this is insulin, I took some out of here to give to administer to the last patient. I'm coming back again to get another one for a different patient, or the same patient at a different time. That's when I'm doing this,
Okay.
right? You don't need to do it if it's
The first
intact.
So after usage, we can keep it for at least 30 days.
Correct. All right. Everybody, we need to draw up medication.
Are these insulin?
They're saline. Yeah, little bottle of saline. Who wants to go first?
Anna.
So, this is going to be tricky, but this is what I want to do for you guys. I want you to draw up point 8. Point 8. I only have 4. Alright. 4 people draw me point 8. CC. Don't forget sterile technique when you're drawing up medication as well. Contamination as well when you're drawing up medication. Stop. How do you open this? The bottom. Where are the flanges? There's a little rib right here. 30.8.
Okay,
Or should I show you guys how to do it first?
Yes.
Everybody seems like,
Scrambling.
I don't know what I'm doing. I look scared.
Yeah, very scared.
Okay. So I'm drawing up medication, right? I pull my syringe off. I always do this. Try not to touch the
Okay.
part of it. It's a clean but also sterile technique as well. You do not want to touch anything inside, right? I grab my medication. I do not need to wipe it once I open it, but I am wiping down the area I'm about to give this medication in, correct? What have I verified before I go in, when I'm going to this patient's room?
Identification.
The name.
The name. Two identification verification.
Then the medication. The medication.
Mm-hmm.
Then the dose.
Mhm.
The dose.
Mhm.
The
The
route.
routes. Very important. Okay? And I'm putting it in. Try not to touch it so you don't contaminate the tip of it. And you draw. Some people say before you draw insulin, inject a little bit of air
Yeah.
of how many cc's you want to draw. What that does is help push the medication out. That's what that does when you do that. So the reason why I always hold it like this is because I have a better control of it. You will find out what works best for you, but that is what works best. And then you draw the medication out. Okay? Never recap. Never do what I just did. Never you recap. It is. What I'm saying is that most people do that because they help push the medication back into the syringe. Most people actually practice that. And sometimes I do that if the valve, it's actually, there's only a little bit of medications in there. That helps as well. To get as much medication as you get for the case.
In case we always say when you want to drop insulin, you have to put hair
Inside of
on
it.
the NHP,
NPH.
the NPH first, then you take it out and put hair on the regular, then draw it and go back to the NPH.
Yes. That if you're doing two different medications.
Oh, that's we are reaching two
Two
different.
different insulins, correct. So you're putting air first in the first one and going back and putting air in the second one. Do you know why you do that? Let's take for instance. I'm going to draw up medication from this group. This is NPH and right? I put N in this one. I didn't put N in that one. I just put N in this one. I drop my medication. It's easy. See how it flows out? Very easy. I come out. I need to take. How do I put N in this without putting this medication in there?
It's not possible.
It's not possible.
Except you want to use
And
another
that's
syringe.
That is why when you're drawing up two different medication, this has to be clean. You have not drawn anything in yet. You come, you put air. I come out, I go in here, I put air. I take out my medication. I'm out. By the time I go in here to pull up my medication, it pulls it back automatically.
So you put hair in the first one.
Oh!
Now we mix it. That is the rationale for that.
You
Correct.
put hair in the first one, you
First
take
one.
it out,
Then
then
you
you
go
go
to-
to the second, put hair, then you draw your
Draw,
medication,
then
then
you
you
go
go back
back
to
to
where you
regular.
are. Okay.
So it will automatically pull it
pull
back
it
and
back.
give you the measurement for the first one.
Oh God. Okay, okay.
I said the rationale. I just read it and I was like, what does it mean? Okay, I will do it. But I don't know why I'm doing it.
That is the exact reason why you're doing it. The only reason why I won't bother about doing that is I look in here, there's 5cc in here, and I have to take out 5cc. I don't care about putting air right now. I'm gonna go put air, take this out. I would put air in here, but guess what? I know I'm taking everything in here, so it won't matter, right? But if you're only taking a fraction of it, you have to put air in it first before boiling. All right, I'm gonna let you guys draw up 0.8cc for me. Let's go. It is not that hard.
Oh God.
I'll be waiting for you guys on the other side.
On the other side.
I'll give you this. Okay.
There's always that.
Point eight. That's orange is too big there. That's way too big for you.
You can use one. Once you're
So,
done, can you use
You're screwing it on, not pushing it in.
I'm pushing.
No,
Oh, I should screw.
You're screwing it on. That's what I'm saying. I see you pushing. You're not pushing. You're screwing it on.
So, we can use one or you want to do it.
That's fine. Hold on. There should be enough
Point
needle.
eight, right?
you have to
0.8, correct.
do it as if you are doing it. Yeah. You have to do it as if you are with the patient.
Why?
Oh, yeah, that's it. Okay, this one.
What about
But
it?
this one is too big.
You know what I'm saying? Where's the syringe? Oh, yeah. It's fine.
Point eight. You took yourself.
Frank.
You know the way you are doing it, huh?
You could use that. You know that, right?
That hair you put is too much. So that's why it's injecting it back for you like that. So now if you want to put small hair, put small hair. Then you draw where you want to draw.
What does that look to you?
So this is it.
All right. I need everybody to come behind me for a second. Can anybody tell me what number that is?
This time. Right here.
Mm-hmm.
It's 10.
No, but how many has she drawn up?
Okay, now she has drawn up 10.
Looks like between
So-
0.7 to
This is 1, right?
Yes.
That's where the 5 is. I said 0.8. So that would be the nut line right underneath it, right?
Okay.
The first one is 2, 0.2, 0.4, 6, 8, then 10, right? So right now, she's at 0.6. So it has to be right, and that's what I want you guys to draw. Especially when you're drawing insulin, it's very important you're drawing exact.
So this line is 1.
Yeah, so the very
The long
first one,
one.
yes, the very first one is 1, and then you work your way all the way.
So this.
Yes, I'm very, you have to be very careful so you don't poke yourself. You have to be firm but gentle at the same time so you don't end up poking yourself. It's harder than it looks. Don't forget 0.8, you're not getting to 1. 0.8 is the line right before you get to 1. you're borderline. You're not at 0.8 yet. You're still a borderline. See that? So you're not giving the patient the exact medication. No. Not 0.8. Really? You're almost there, but you're not quite there yet. You're still, I don't think you moved from the last time you gave me. You're still in the same spot. Don't forget, your accuracy depends, especially if you're giving insulin. That plays a big role on the medication you're giving to the patient.
Okay, you know what? Yeah. I was also looking at this line, and you know that this second line.
Yeah.
Did I move?
I didn't know that I was here. Okay. Yeah, okay, this is the,
Yes.
sorry.
I moved, right?
You're okay, yeah.
Okay, this is 5 right here.
The very long one, right there.
This one is 5.5.
No. So, this,
It's 2-2.
we're doing 2.2, 4, 6, 8, 10. And I said 8.
Okay.
1 is 10, so we have 2, 4, 6, 8, 10. 1 and 10. 10.
Yeah, this is Yes. And it is that tough in real life when you're trying to get the exact medication. Don't forget, if you're giving an insulin to a patient, you end up giving too much insulin, what is going to happen? Does anybody know when you give a patient too much insulin, what's going to happen?
Lower the sugar.
Hypoglycemia. You cause the problem for the patient. And if you don't give the patient enough, what's going to happen? Blood sugar is still going to be high. It will not be under control. Okay? That's why that is very important.
So those are we can do like a 2.
So, is the syringe I gave you? Again, the reason why I brought that syringe is if you can master that syringe, you would be able to master the other one. It will be easier. Yeah. All right. Okay. I was going to do a statin and IV. No, that's not. It's a red top. That's the wrong one. What's in this? Has anyone here started an IV before? No. I don't know who you're going to start an IV for. My last clinic, I actually had a student started on me. Yeah, it was not fun, but she had to get it. I don't think I have the strength for that today. But how do we set up an IV? Do you know how to set up an IV? You don't know how to set up an IV? What do you need to start an IV? What do you need? What are your supplies?
The syringe, IV fluid. What's it called? Tourniquet.
So what else do you need to start an IV? If you look up here, you probably should, you will be able to tell me what you need to start an IV.
So we need the syringe. No. Yeah, and this is the line.
You need it,
I need it.
So, say you should start an IV. You get your supplies. Okay? What is the purpose of the tourniquet?
To pop the
vein. Before you do this, you always want to palpate to make sure you find the vein first. Some people are very good. Like if you look at me, I have a very easy access. I'm a very easy access when it comes to when it comes to finding. Like you can trace, mine is like really, my hair is the best.
This is the best I have. So
Yeah.
the most people always.
Relax your arm. See that?
This is it. No.
Right here.
This green one, this tiny green one.
So it is not this one.
It's not this one that you're looking
I
at.
once,
This is.
I once had somebody that said they injected him with
Yeah, that's.
And it's very-
This is.
Yeah.
That's what is it
That's-
called? Where is my?
That's,
This is it.
Yeah.
That middle one.
the one that looks like a
That
thunder.
thunder.
I always say it looks like tree too, with branches. Well, it is there, but I would not try it with you on here.
Yeah,
I think if anything, usually this is the best part to start to try IVs.
Yeah.
But as a new nurse, this is the worst part you want to start with. You know why? If you start an IV here and it blows, you're screwed. Because once it blows here, you can't really go down. If you start here, this one blows, I'm going to go up.
What do you mean by saying
I think it doesn't work. Because as a new nurse, it took me good maybe 3 years before I got perfect in IVs.
Wow.
It's just that. It's going to take you a while. Yes. The list will say yes. So it's some people grasp it real quickly, and some people it just doesn't come that quickly. First, it took me a while to figure out what the vein is. Every time I'm like, I can't find the stem. But the more you do it, the better. God bless you, you're on a unit that you barely put an IV in. You're on your own. Because that's what happened to me. I started with a surgical unit, and every time they come down from surgery, they already have an IV in.
Oh. So you don't have to.
So that's why it took me so long. But if you start from an ER, ICU,
Nursing
Nothing
homes.
homes.
I've never worked
Nothing
there
homes.
before.
That place is crazy.
It's crazy.
Good, I'm never going there. Never going there. But yeah, so when you start with places like that, then it's easier for you to, now being in the OR, we don't put IV in. We have the luxury of not doing that at all. The anesthesiologist, OR,
Okay.
the anesthesiologists are doing everything. So, but yeah, so to put it in, it will take you a while. So if you don't get it the first, second, third time, don't beat yourself up. It takes some people like us 3 years to get it. Okay? So, what is the purpose of this again?
To hold to make it visible.
To hold down the
To hold down the muzzle, the blood. No, but I know when
So
you
close the blood, from
From-
flowing,
because I know
and
when
also
you
pop the vein a little bit more for visualization. Okay? So you get that? Do you want to know what this is? I'll check it out. To place it on. Once an IV goes on the patient, if you look at this, you see this? That little price there? That is what goes on the edge of the hub of the needle to hold it in place. That is what the purpose of this is.
And so this one, do we write the time and the initial on that? At the age?
Yes.
Oh, okay.
So you do write it on there. Always dates and time, and initial your IV or whatever it is you're placing in the patient. IV, Foley, whatever it is. Always date and initial it. All right. So I will let you guys go ahead and open that. And I want you to spike this bag. Please don't wet the floor. Let's spike the bag. Let's see how we do this.
Can our home go to this for?
You tell me.
No.
Yeah, we can. Or we can go to.
I mean, like, what she's not saying is, but there's a cap on it. No.
There is a
Yeah,
cap
there's
on
a
it,
cap
so-
on it, so. But I'm not supposed to don our gloves before doing it.
Not sterile glove, but yeah, you're supposed to put a glove on. It's a clean case, not a sterile case. If you once you go in a patient's room, you should be wearing a glove. Period. Well, you're doing good.
I think I'm appreciating my old nurses now. That man is just sitting down, sending me everywhere. I think I appreciate what they do. So this one, this is the one I do.
Good job. Stop. You're about to put that through. Let go of this. This is wide open. Once you put that through, guess what's gonna happen? You're gonna wet my floor. I just said do not wet my floor.
Okay.
I didn't say that to the psychiatrist, but I said that so this can,
So that I can lock this.
So
so
this
you
is
can lock.
open.
It is open, yes.
Yeah, it's locked. Well, this one is open, there is open. It's open. So, I think I'm doing it. So this, I'm handling it.
Stop. Go through it and make sure everything is locked.
So it's not like it, is it low?
Yes.
That's it. So when it's up like this, it's not.
Don't worry about it. Those one controls medications when you're giving medications.
What?
Skip the training.
She
Where
said,
to start?
we wanted to start, but she said, make sure everything is locked. So we're trying to figure out where it's not locked.
Make sure yes, everything is locked as well.
Which other part is open again?
Bingo.
Oh, good job.
Bingo. That's it. We got it.
That's why I told you we should do this. Okay, so we have another issue.
Yeah, okay.
What is your issue? Oh, you don't know which one to put it through. That
Yes.
is nice. I love
So,
this issue.
no, this is weird to put it in.
Are you asking me or you're telling me?
No, I'm telling you.
Okay. So go ahead and strike it. Go ahead, strike it.
Where to be?
Contamination. Part 1, part 2, part 3. You guys go ahead.
Okay.
Go ahead.
You need to open
Oh, you guys, no. You opened the wrong one. So
Why?
you two have two different wrong things going on.
Okay.
You took the black cap out. You see that?
This is
The blue cap, sorry.
Uh-huh.
That is for injection of medication into the bag.
oh, that is the version.
See, we don't know.
That's what I said. This is the one that we're going to open.
Okay.
This one that you're opening,
Yeah.
you just open this part and said inject, spike.
Yeah,
You
that,
can't spike through that.
I think it's part through. This part.
oh, okay.
How did you do it? I
You
didn't
pull
see
it open.
Down. Spike. Oh.
Pull it out. Harder.
Take it out.
Is that okay?
Is it in all the way?
No. No. Oh, so after doing that, we have to press.
I do so I can see it running.
Oh, okay.
Because once you press it, then you can tell that it's, but you only want to do a little bit of it so it's not all the way up. You can't see if it's running or not.
So,
we can open it.
so it's good like this?
Yes.
Okay.
And you're all locked everywhere, right?
Yes.
Okay.
If not, we're gonna clean it.
Okay.
So what do you touch for it to start dripping like that?
Push that. Push.
Just like this.
Push hard.
That's it. So,
Okay? And you can see your tubing priming.
Frank, did you open it?
He did. Yes, he opened both of them. So you
Frank.
see.
You're already putting more time. What happened there? What happened?
You disconnected your. So you see.
You see?
Anna, you did it?
I think it's nothing if you drag too much.
That also teaches you a lesson. You gotta be careful. Make sure all your connections
Outside.
are intact.
So this
That was why you
You
were
don't see
asking.
anything going?
That is why. Yeah.
If you want
Yeah.
to go, I will have to regulate it. So now my question.
Yes.
Regulation.
Okay.
So how do we regulate?
So
So I think we are
Sir?
good now.
You see,
No, it's okay, I've locked it. Yeah. We are
So
good now.
these is their pumps. 99% of the facility have a pump that you regulate it to. And you just put it in. So those that don't have pump, you use this to regulate it.
Well, this one does not have.
Everybody has,
It doesn't have normal, but you have to push, right?
yeah, push it open.
Push it
So
open so
If you want it open, how open?
if you want to give a bolus, then you're opening it all the way. So it's just going into the patient.
Or if you want to
If you're
turn
giving
it,
blood, then you,
I want to give you
Okay, okay, this is,
if you want to give a bolus, you open it all the way. So you see how, depending on how far she opens it, you see it dripping. So
that's
if
the
the
drop
doctor
factor.
prescribes 100 ml in 1 hour, I would time it for 60 seconds. Depending on how many drops, will tell me if it's going to run an hour or not.
So that's the drop factor.
So thank God for technology. It got easy after that.
just open it a little bit.
Yeah. Go ahead, keep opening until you see it coming up.
Yeah.
You see that?
Yeah.
so this one now is to,
Where does this connect to? Where does this connect to? To the hub of the syringe in the patient. This is what's in the patient. This and goes in the patient. Don't forget, this is already in the patient and it's taped down. So you connect that.
But you have to attach needle there to put into the patient?
Yes.
It's just an example.
No, this is the IV in the patient.
okay, this is already in the patient.
Correct. And don't forget, it's not a needle that's in the patient, right? There's a little plastic leftovers.
Okay, so you come and attach now the medication to enter the patient.
Correct.
Yeah, before you touch me, what you want?
If I just put the IV in, there's no point wiping because everything was just clean as hell. It's if You're closed, right?
Yes.
So,
So,
you're not closed.
this is not clear.
You're not closed.
So let me ask you, excuse me, when you for open and then this one also, you have to open for it to go to the patient. Where is it?
This one?
Yeah.
Yes.
And the bolus is giving, the instant
First time, yeah.
bolus, boom, 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 boom. That's right,
fast.
that's right.
Usually when it's in the patient, there's an IV lock. It's usually like this, right? This is in the patient, and there's like a little bit of tubing out. When you want to go reconnect IV into a patient, that is when you're wiping this, and you're wiping that, and then you connect. When you open that, always know that there's also a lock in the one on the patient. You also have to make sure that that is open that as well. If not, it's not going to go in the patient.
It's making sense now.
So how do you prime the IV?
You just did.
The one that they hook,
Yeah, that's
some
what
of them
holding
is
it.
down of it is up. Is that in your
So that's when you're giving us primary and secondary IV. Let's say there's an IV fluid running already, and the doctor prescribed a medication, a secondary medication. The secondary would not go up because you want that to go in first, and then you lower the primary one so that when that one finishes, air is not going into the patient's IV, the second tube is going in.
I didn't get it.
So her question was, you know how sometimes there's two IVs, one is up and one is down? So the reason for that is always called the primary and the secondary one. The primary is usually a bag like this, normal saline, hanging. But when the doctor prescribes an antibiotic, for instance, 500 Clenda, you put the Clenda in. Because you want the Clenda to go in at a time, because remember you have to chart it given at this time, right? You put that on top. Because don't forget, with gravity, the one on top goes in first. So once you put that up, you lower the primary one down, so that would go in. The reason why you still have the primary one connected is because after the secondary one finishes, you don't want air going into the patient's arm. So the secondary one will now kick in once the primary is done. Okay? Any other questions?
I think I did.
Now it makes sense,
Makes
right?
sense.
So all this like this is to pass medication.
Yes, this is a more advanced
Yeah, can I
technology.
Oh, okay, now we have 4.
Yeah.
So is it, okay, for example, we have 4 medication to pass.
This is for advanced. As a nurse, you wouldn't have to worry about this.
Oh, okay.
I've never seen this for the first time.
This is a more advanced this thing, and this is what we use in the OR. When a patient is sleeping, I need to push medication to make the patient sleep. At the same time, I really need to put in medication real quick to relax the patient. And then at the same time, I need to be giving the pain medication or numbing medication. So I have to have all 3 connected to.
Oh, that's my question. You understand what I was trying to ask?
Oh.
Yeah.
So you put another one, then
Then
after you finish this,
You
put
go to this,
you open.
open.
Yeah.
That says, so you're locking it, you're opening it. I give my medication.
In bracket.
And it's locked. It's this thing. Like, why am I telling resistance?
Yeah.
It's locked.
Okay. Can I open it a little bit?
No, that one is going to run through. You know. He knows. The water is going to run through. So usually,
Okay, because it's locked, that's why it's pushing back.
yes.
Yeah.
That's, and once you push back, you know there's a problem.
There's a problem
What's
with
going
this.
on? So usually there will be 4 syringe connected. I'm opening, I give, I close, I open, I give, close, I open, give, close.
How do I push?
This is,
No, that's medicine.
This
this
is
is pure medicine. To
This is
put-
basically for emergency.
That's
You
it.
don't want to waste
When
your
there's a
time.
code and you need to do that,
Yeah.
That's what we're doing.
And what about this one?
But sometimes they add the
Instead of using
they
one
add
root,
so-
you know.
Throw this one.
Yeah, but this one, for as a nurse, then you will do this part, right? But as far as this part is concerned, it's a more advanced training for this, to be able to use this part of the tube.
This is when fire becomes a man.
Ask us to do that.
To do
Have
this,
medication for that.
Depends where you work, depends the situation you find yourself.
so you shouldn't have this on your regular floor. This ICU
Operation
and
or
OR. These are the places you're going to find us. And the people that usually handles this are either anesthesia or trained ICU trauma nurses. They have to be a trauma nurse to be able to handle this. Okay?
But normally, normally in a normal facility, you pass medication here. Or there are sometimes they come to the patient this is
To the IV and pass medication.
So depending on the medication you're giving, right? Don't forget, that's why all this is what is connected to the patient. If I need the medication to go in right away, I will bend this, wipe this off, and I'll push medication through here.
Oh, okay.
You bend it.
So she
I'm
closed
uploading
eyes.
it.
Okay.
Me doing this, this is open, right?
Right.
I don't feel like trying to close it.
Okay.
I just occlude this and give the medication.
How fast?
So if you also want to draw blood from that line,
You can't drop off of this.
from this line.
So you can't drop blood from that. The vein is already in use.
Yeah, I like that. Big vein is big already.
All right. When you're doing, are we okay with IV?
Yes.
So this part is for
If you have to put medication
if you
inside
want,
the
if you want to put medication inside here. So one thing I can think of right now, at the top of my head, which is probably not the best practice, is when you have to put like an antibiotic in here to give, like in 1cc vial, you draw it out and you put it in here for it to go through. But these days, the medications don't come in small bags anymore. They come in like a little bag, like a 50 cc's. Exactly. So before, when it used to come in a smaller vial, then that's how you do that.
But if it comes with that, then you connect.
If it comes with
the bag.
the bag, that's exactly what I said. You hang it up, it goes through, and this primary becomes a little. Okay.
Good. Thank you so much. Wow. This is good.
Okay. One thing I can do here with this is wound injection.
How to do injection?
So to start an IV, by the way, we're putting this, you're occluding the hand. Once you occlude the hand, you find the vein.
Okay, well, so, some people normally do this.
It's to make the vein pop. Or sometimes they tell you make a fist. If you notice you make a fist, it pops more. So I'm going to use my hand as an example because my veins are pretty out there. Look at my hand. Just by looking at it, you don't see anything, right?
Because
I
I
mean,
mean, a lot of
it's
water, so that's why it's out.
I do.
Yeah.
Once I hit it, you see how it comes out a little bit more? Once I squeeze, what do you see? It's more visible. If I put this on, my hand will explode.
It's not tight.
It's not tight.
Let me see.
You guys come and tie this on
Each other?
on each other.
Okay.
I need you to know how to tie this on. That's not tight at all. You have to tie that the person goes out. I mean, not ouch, but you're going to feel it.
Right here, right?
Anyway, just
Okay.
I want to see you tie it on. No. No.
Okay, she wanna try.
Okay, you want to try it again? No. No.
Okay, we give up. So watch you do it.
Is that okay?
All right. No. Watch me. So when you put this on, before you even tie it, you want to stretch it out.
Okay.
You don't. What I see you guys doing is tie it. And,
Yeah.
no,
We have to stress.
you stretch it out first because when you tie and start pushing, you're going to make that hand turn blue.
Oh.
So, if you stretch, no, sinuses is blue. That's it. And you see the difference? It's tight. And when you if I want to take this out, all I need to do is this.
Okay.
When you tie it like this, and patient starts screaming, it's harder to take it off. Exactly. You see how it pops?
And see, this, no, see, that's not it.
Yeah, that's it.
But not this one.
No. You see how it all pops out?
See, look at it.
Mhm.
So you can just get it. Fine.
Okay. I can see you're popping red. Yeah, that's good.
So, what about if you still do it, you cannot find a vendor, what should we do?
You call the expert.
Oh, okay.
There are people specialized in doing.
You cannot find a vendor.
Yeah, there are people specialized in. Usually, I try to put an IV twice. If I don't get it a second time, I'm calling somebody.
You're not going to kill me.
I think they are doing a good job.
It's tight, but not.
Can you see? Yeah.
That looks good. Yeah, that looks tight.
So you can see.
But really, it will take a lot of time. Yeah,
I
it's
can
okay.
see. This is it. And if you really want to see, just do this.
Or just make a fist. Make a
Yeah,
tight.
she did.
Make a
Make
tight
a tight
fist.
face.
If you notice, release,
With this.
tight. See the difference?
So, just do this. I'll be pushing you. Oh my God.
One more thing I'm gonna go over with you guys is wound cleaning. I go see a patient, and the patient has a big wound that I need to go and clean the wound. What do I need?
There's a, I think it's a bag. A biohazard bag.
Use a regular trash. You could use a regular trash.
Read a gauze.
Okay.
Gloves.
The treatment, I don't know.
The tongue, what is it called? The
That's if the doctor prescribes a treatment. But if you're just doing just a regular wound, wound change, normal saline, depending how deep the wound is, yes.
Water.
Yeah. So,
why do we have to do that?
do what?
You just
I want to show you something. If you want to clean a wound, what's the top of this? You want to clean a wound, and the doctor asks that you use saline. to irrigate the wound. You're not gonna go get a bucket of saline and pour on it, are you? How are you gonna irrigate it without messing up the patient's bed?
You put the pad under the wound.
Uh-huh.
Put the pad there.
Okay, but how do you intend irrigating the wound without soaking the patient's bed? Because you can put a pad, but if I pour, this is a pad, and I pour water on there, do you think that's going to prevent the whole water?
No.
So how am I going to irrigate this so it doesn't mess up the patient's bed?
I don't know.
Oh, that's why you get the syringe.
Okay.
You get a syringe, and you get this. If I'm pushing on this side of the wound, this is where the wound is, I have a better control of irrigating this, right? But if I just take the bucket of saline and I'm pouring, it's going to just drain everywhere. Whereas with this, I can do this and use a gauze to clean it, or suction to suction it out, depending on how deep the wound is. So this gives a better control when you're irrigating a wound.
Okay.
Okay? If you finish irrigating, you have to put a dressing on. How are you going to put the dressing on? All right. This is going to be your dressing, your patient. This is your dressing. I need you to put a dressing on this patient and take the dressing on the patient. I need 2 people to do that. Oh, and your gloves. Let's see what I have. I have gloves. These are big. Alrighty. Who's gonna?
Okay.
Okay.
Okay, I think, sorry, you work in the facility, right?
So these are non-sterile. These are sterile. I want you to try sterile because this is a sterile technique.
You didn't try. Go try right away. Yeah, you go.
Open the gloves.
No, 2 of them are dead.
Open the
I think
gloves.
they work in the
This is a wound, right?
Okay.
This is a wound. I need you to open this glove, take dressing out, put it on the wound, and this is your secure tape
Secure
to
tape,
take
okay.
it off. Let's do this.
You get that?
Oh boy.
I know, right? No, your gloves first.
This is
She's right.
because this is
She has to open this
Yeah,
first. If she
yeah,
puts a
yeah,
sterile glove, how she gonna open this?
you're right.
Good job, girl.
Good job.
I was guessing though.
Okay.
Try not to touch the inside. The
Yes.
inside is sterile. It's actually packed, but okay. that
So
works.
now the wound is there.
Mm-hmm.
Now I'm gonna get
Try not to go over the wound because once you go over your sterile pack, what did you just do?
Contamination.
So try not to go over. When you're opening and your thing is flipping back, you're contaminating your field.
You have to start very careful. No contamination.
You're upside down. Flip your glove around.
Okay. Yeah. Oh. So.
This is what you were doing last time, right?
Yeah.
I'm looking at I was not here.
The last one I was not here. So
Yeah, me too. I saw the video, but
it was not clear.
Oh, it wasn't clear?
it wasn't clear.
If I'm the patient, you're opening glove like that. I swear to God, I'm already nervous.
Yeah, you're gonna say no, change it.
You don't have to, this is the wounds. But it's not going to be on the same table.
Patient is already
Your glove
worried.
just got contaminated.
Ah,
You
because
gotta
this
be
thing-
very careful with this. So usually when I open it, I always go like this to keep it flat.
Me to spread my finger.
What size is that?
Use 8.5 is good, but I don't know the way
Don't forget, it doesn't have to be perfect. Once you put your second glove, you can adjust it.
Okay.
Oh, you don't know? It's fine. She's fine.
Okay.
The glove is big. Oh no.
What did I do?
You just touch and contaminate yourself and everything else.
So this needs to be from here.
Watch me put the glove on.
Let me watch.
Okay.
And then you adjust once the glove is on.
Can I have one and try? Sure. It's good. Because I was not here the last time. Thank you. Okay. You were here last time, right? This is serious matter.
Would you use this before or after you put your gloves on?
After.
No, before.
What do you
Before
guys
put your
think?
gloves.
Would you use this before or after you put your gloves on?
Before you put your gloves on.
Before you put your gloves on. Because this is not sterile, right? If this was inside your kit, the sterile pack kit, then you can use it after. All right, go ahead.
Already used this. Let me say the wound is already medication, everything is there.
You just contaminated yourself. You are at the very edge. When you already open this, you touch this edge that contaminated every edge. When you open or take something that is sterile,
Just pick directly
from the middle.
Okay.
Your dressing is a little distracting.
It's different. I never
Yeah,
seen
you
this
have a-
kind. Why is it like this?
I thought I was grabbing this, but it's something else. But
So
it's,
let's pretend like that.
Yeah.
That one. Okay.
open it up, take it off.
Oh.
It's take one off. Yeah, it's one big piece.
Start from the middle.
Yeah, you're not cleaning, right? It's already cleaned. All you're doing is dressing it up, right?
Dressing it up.
So I don't want to open the band. So I'll open and put
And put the tape on there.
and put the tape on it.
You okay?
I tried it. How many do you fit? Two?
Yes.
I think she said it depends on the wound.
Depending how deep the
How
wound
deep
is.
the wound is.
Like if you see this one, this is a packing, right?
Ah.
This is so. I meant to get two guns, but luckily I got this. So if you, the wound is that deep that you need to pack it, you put this in and you chuck it in.
Oh, wow.
You chuck it in the wound to pack it in. And you, when you after doing this, you always want to document that you have one packing inside of the patient's wound. You leave this.
Do you
in.
put saline in?
You leave it.
Do you put saline?
So usually there are different type of medication prescribed. It could be saline, it could be anything based on what the doctor prescribed. So, and if the wound is sore as well, that is also another thing that to put into consideration when putting this in. Okay.
So you cut this and
Then you pack
sorry,
it.
call it packing, right?
It's called packing, correct.
Okay. But if it wasn't packing like this,
It would be that dressing.
dressing,
above.
and they put the-
Then you put that and you put a tape over it.
so with this one, you just leave it as
You put a tape over it. It's just different. It's just different types of tape.
okay.
Like with this one, you put the regular silk tape over it. With this one, I would put a bigger tape, like a foam tape on over it,
Okay.
so it covers it better.
So the tape will be around like this, like a square.
No.
So no, the tape. This is a smaller tape, by the way. The tape would perhaps cover the whole dressing, because if you only put it around the four corners, give me a reason why the middle can get wet. Exactly. So that is why you have to cover the whole dressing, so that just in case somebody splashed something, it doesn't wet it and goes into the. Because this is just a very thin gauze.
So you have to cover everything.
Correct.
And when opening, when bringing out
The dressing.
the dressing, you
go
don't have
from
to
the middle.
touch. You go from the middle, right?
Yeah.
You pick up.
Because you have the sterile gloves already. Okay. There are some dressing that they have, it has foam.
In the middle.
Uh-huh.
That looks. It looks like it's called Primapore. Don't have that in me, right? It's not in my picture. No. So it's literally a big dressing, and in the middle it has like it's a big band-aid. I should say, because if you look at band-aid, the middle has like a little small square covering on it. Imagine that in a bigger size. So that is usually used for a dry surgical wound. There's an incision that needs to get covered. The incision is this long. You just put it over it to cover it. Was I that bad with contamination?
I know, because you didn't see how well she's doing it.
Yeah. So I think that's pretty much it. Anything else?
Yeah, and shop now. Shop.
Give you a shot.
Yeah.
So
You want to know.
it's pretty much the same thing. What do you
How do in the middle to do the iron?
Okay.
So the IM
I don't want to inject this in anybody's body.
Hello.
Hi. Evening. So give if you're giving insulin,
Oh, you've
if
been
you're
working
giving
on that?
insulin on the patient, usually they use the abdomen for it, right?
Oh, which
Hold
one?
it, insulin.
Okay, yeah, for instance.
So you want to hold it.
Put your stuff in this side now.
So you want to hold the spot, clean it up, and then you go straight, and you give 90 degrees.
90 degrees.
90 degrees, yes. It's not, I know, the needles are really small.
Yes.
Where's the needle you use?
The one I use.
No, she used. So there are different types of size of needle. I think I brought about 3 different sizes. This is an 18 gauge. Oh, this is a 30. Do you see how smaller it is? The one for the insulin is actually even smaller than this. So I remember the first time giving, I was like, oh my gosh, I'm going to put the whole needle and hit someone's belly. You'll be surprised that by the time you push it in, it goes in. It's like the whole thing is in. And then you give it. But don't forget that when you're doing it, make sure you're also holding the patient's belly, not leaving it flat as well.
Yeah, you hold the skin.
The skin.
Use the skin.
So you don't want to go way too far. You want it into the,
In the
yeah, 2 inches in the belly. But again, if you're using the right syringe, it goes in all the way.
okay.
It's when you're not using the right syringe that I got to worry about it. If you look at this, 2 different syringes. If this is the right one, I don't care, right? But if I'm using this, I got to, exactly.
Gotta hold this.
Okay?
But you can give it on the arms too.
Same thing. The IM on your hand.
So how do we visualize the abdomen process? How do we?
So it's usually, so it's usually the fattiest part of your arm.
No, not for the insulin, for the iron.
Yeah. It's usually the fattest part of your arm that you're using for that as well. So you're gonna.
Do you still hold it?
Yes, if the person is skinny like me, you want to hold it. You don't want to hit my bone.
But insulin usually is around here, the fats, and then it's around here.
So insulin is back here. It's on the thigh area. Iron is right here. So which is also the fattiest part of your skin, right? Again, nothing says you can give insulin here, but it's preferable to do it here. But when you give an iron, this is the part that has the most meat on the side of your arm. So you hold it and you give. It's just like flu shot. When you go get a flu shot.
Yeah.
Yeah, I know some people don't like this. It seems like they measure from here to there to around.
It's comfort. It's comfort. It's not a measurement. When someone puts their hand over you to give, it's a comfort level.
Oh, okay.
It's hard. So if I'm not gonna do that to you. I'm doing this. I'm holding her, so it's in the right position I need to inject. It's more of a comfort thing than a measurement.
So here in the last week, you can give anywhere.
On the thigh? Yeah. But again, I always say look for the fattiest part of the body. The fattier, the better.
And they also move it around, right?
You always rotate to sides, yes. You do never give it on the same side over and over. You're going to cause bruising on the patient. Z-track? As in, zitromycin? Oh, the when you say Z-track, I went to the antibiotic.
But how come some people always do it on their stomach?
Because it's a again, if you look at the stomach, it has the most fat of the part, right? Some people, like someone like me, God forbid if I have to get it, I'll get it in my stomach than my arm. Because I don't have much meat in my arm. So it's easier to, you don't feel that much pain when you get it in your stomach compared to when you're getting it in your arm. And don't forget, it's always patient's preference as well. So if I notice that whenever you give me my arm, it hurts, I was like, no, I never use my arm, only my belly.
Some people want to take only in their stomach. So what one lady was doing, if today's gives here, the next day she gives here.
I usually do 4 quadrants. I give here today, I come here, here, here. I rotate that way. So it's pretty much when you're giving the shots, you're using your arm to move it out, and you're giving the shots. It's pretty much clearing the air and making it, for lack of better word, smoother to give it. Nobody really used that technique.
Is it for the specific medication that you use?
Yes, it is actually for it is for a couple of specific medications. I can't think of the names, but it is for a couple of specific medications. But again, it's iron medication. It is an iron medicine. Iron injection. I just can't think of the name of it. But again, it's more of a nobody uses it to give that, to give it. But for, I guess, usually, NCLEX is, when you graduate, you will notice that NCLEX is totally different from the word. What you're learning in the book is completely different from what the word is.
Yeah.
It's a 2 different word. I will tell you right there, you might graduate and come out and you're doing it the book way, and someone will tell you that's the wrong way.
It's true.
Yeah.
It is the truth. The Z-track, it's good and ideal, but if I want to give injection to someone in a fatty area, why am I shifting the fat away? The book explains it to say it makes it smoother to do it, but again, I'm moving the fat. I'm killing my purpose of it. All right, any other questions?
No. Drawing of the
I never done
the
before.
syringe.
of the syringe.
I mean, you can
Hold
try to
on.
draw syringe. It's actually very hard to try to draw syringe. Saline out of this thing. You can try to see if you're going to draw one out of it. Yeah.
We don't.